The pace of coronavirus vaccinations in the U.S. continues to slow. The nation is averaging around 185,000 first-dose shots per day. That is down from more than 480,000 when the pace was climbing back in August. This comes as the CDC releases a study showing just how effective these vaccines can be, especially for children. Lilia Luciano tells us more.
Tonight, just weeks before the federal government is expected to authorize the Pfizer vaccine for children as young as 5, a new study shows the vaccine to be even more effective against severe illness for kids than it is for adults. For kids, the vaccine is 93% effective against hospitalization. For adults who are not immunocompromised, it's 88% effective.
This is great real-world data that should urge parents to vaccinate their kids.
Tomorrow, the FDA is likely to authorize the Moderna and Johnson & Johnson booster shots. The agency is also expected to say that mixing and matching vaccines is safe. For example, a person who was vaccinated with Johnson & Johnson could get the Pfizer or Moderna vaccine as a booster. Infectious disease doctor Monica Gandhi says it's good news. It doesn't just protect you against hospitalization, but even infection or having any symptoms at all?
Exactly. And yes, there was improved protection from any symptomatic infection.
Getting COVID after being fully vaccinated remains rare, but Colin Powell's death from COVID this week brought the immunocompromised and elderly into focus. Powell was 84 years old and also had Parkinson's and multiple myeloma.
And that's one of the reasons why back in August, a recommendation from the FDA and then CDC came to get that third immunization in those who were immunocompromised in the hopes that that could bring it up. So he was older, he had multiple myeloma. So if anyone is going to have breakthrough hospitalization or a breakthrough death, unfortunately, it's someone like the general.
In one of his last interviews, Powell told reporter Bob Woodward, "Don't feel sorry for me, for God's sakes. I haven't lost a day of life fighting these two diseases." A recent study shows that for people who got the Johnson & Johnson vaccine, getting a Pfizer or Moderna booster isn't just safe, it could even be better protection against infection than getting another J&J shot. Elaine?
Lilia Luciano, thank you. Dr. Adam Brown joins me now. He's an emergency physician and the COVID-19 task force chair at Envision Healthcare. Doctor, thanks very much for being with us. As we just heard, a new CDC study found the Pfizer vaccine is 93% effective against teen hospitalizations. So far, less than 50% of adolescents and over 53% of 16 to 17-year-olds are fully vaccinated. Are you seeing hesitation in that younger population? If so, what's at the root of it?
Well, I think what we are seeing is there is still a lot of hesitation, and there's a divide here in America between what we believe, or what some folks believe the vaccine is good, and others that do not believe it's good. But the facts are there that this vaccine is very safe and it's very effective at preventing severe illness, death, hospitalizations. And as just the study came out, it's even good for preventing illness in the first place. So I think that we've got enough data now to really say definitively that the Pfizer vaccine is very safe for children between the ages of 12 and 17. And I'm looking forward to hearing what the FDA and CDC have to say about kiddos between the age of 5 and 11. So as we build more confidence in these vaccines and we get more information out there, I think it's important that we need to be singing in one accord about the safety and efficacy or effective nature of these vaccines. And I'm hopeful that we'll start to get people more in line to get vaccinated.
Well, the overall pace of vaccinations is falling and has been since the beginning of the month. Could this be dangerous as we enter the colder months, or are we far enough along in our vaccination efforts to stave off the worst of a pandemic winter?
Well, sadly, we've kind of seen this happen before. Now, granted, last year we didn't have a vaccine, and this year we do. So that is encouraging. But what does concern me is there's still large pockets of the population who remain unvaccinated. And I think that we've become a little bit comfortable as we've started to see the cases start to decline. That said, as we move from outside to inside with our activities, and we know the infectious nature of the Delta variant, we have to remain vigilant because the potential is still there for the virus to continue to spread from person to person. So, Elaine, we're not there yet, and we've got to get more people vaccinated, especially those that are under the age of 65, and then boosted those that are in high-risk conditions or over the age of 65.
Well, the FDA is reportedly planning to authorize mixing and matching coronavirus vaccines. How significant would that be?
Well, there's actually a few different implications here. So one, I think this is great for those who got the J&J vaccine, the one-dose J&J vaccine, because the studies show that both Pfizer and Moderna have a very robust antibody response. And so that's really good news as we want to start preventing breakthrough infections or infections, period. Secondly, though, this does allow for some flexibility around the world when there may be supply chain issues with vaccination or issues that are associated with just getting the vaccine to people in a certain amount of time. So I think that flexibility is a really good thing for public health officials and for people all around the world. And then third, because we know that mixing and matching, or now that we know that mixing and matching can really cause a robust immune response, that may be something to help us along the way prevent, even when other variants come around, prevent those variants from taking hold. So I see this news as very encouraging. I also am excited to see the implications of the vaccines for mixing and matching, of really expanding vaccination around the world.
All right, Dr. Adam Brown. Doctor, thanks very much for sharing your expertise with us.
Hey, thanks for having me.